Hello, so today we're going to be looking at how to apply Androfeme cream, which is a testosterone cream. Many ladies do struggle with the application, so we've prepared this film and I use it myself and I find it very easy, but it's really important that you find a routine that works for you, not necessarily for somebody else. So I'm going to give you a few of my top tips today, which I hope you'll find really helpful. So this is the tube. And obviously we keep the tube, you can just keep it at room temperature in the bathroom, it doesn't need any special storage. It's usually applied every day, and the starting dose for most ladies is 1/2 ml. And the way I would recommend that you do it is that it comes with a syringe, and you pop the syringe in and give it a really good seal. And what frustrates many of us is that as you pull back 1/2 ml, although it's worked for me today because I'm in a warm room today, often it's been in the bathroom and it's been a bit cold. So often as you pull back to 1/2 ml, you get 1/2 ml of a mixture of cream and air, which is very frustrating and is not going to be clinically very beneficial. So the way to do that is just to keep pulling all the way back and generally have a mix of air and cream. And then once you've got that lovely mix, you then push your plunger back and that's it. So that's what we're looking at a usual starter dose. And then pop it on the palm of your hand, like so, and then you apply it. Now, the recommended place to apply this is on your upper outer thigh, which most women find very easy. And for a lot of us, if you alternate the leg from one to the other, that does minimize the hair growth that sometimes we see. Now, that hair growth is just around the area where you apply the cream. And that hair growth can safely be epilated or shaved off if you wish. Other ladies use lower abdomen or buttocks, just an area where there isn't as many hair follicles to minimise that hair growth, which is a common side effect, but nothing to worry about. And that's the cream. And now one of the problems we have is, well, what does that look like? Some ladies think that the syringe is too much faff, and I understand that. So a lot of my patients say, well, what does it look like really visually? And once you've got used to this, it does become like second nature, so don't worry. But it is worth just watching this film through to give yourself different options to find what works for you. So we'll go back to my method, which works for me. We pull it back. We then put the plunger down and we've got that 1/2 ml. What does 1/2 ml look like? I've got a ruler in front of me and I'm just going to gently put it down. We say 2 peas, 2 garden peas probably, but that's how it looks. So it's worth just having a go. And then once you've decided on the dose that works for you, or the blob size, if you get fed up with the syringe, we understand that, just use that blob size. And when you have your checkup, then we can work around that with you. And the other final way to confirm that you're using that starting dose of 1/2 ml is that this tube, if used correctly, should last 100 days. And that's what's in this tube. So again, it's worth marking on the tube the date that you opened it. And that's another good guide to work out the actual dose you've been using at your follow-up. So pop the date of opening on the tube just to give you an indication of how much you're using and whether you're using the correct amount, because then your symptoms can be aligned to your dose, and your doses can be changed according to your blob size if the syringe is too much effort for you. So once you've successfully applied the cream, if you are using the syringe technique as I've suggested, you will notice that there is a little bit of cream left in that syringe. There's no need to clean the syringe out or wash it out. Just leave it next to the cream in the bathroom and then it'll be ready to use tomorrow. That little bit of cream will stay safely in that syringe.